I think without nurses, the world would be very lost.
The first thing that comes to my mind is I would be very sad if the world didn't have any nurses, because we provide the compassionate relationship with patients, and that would be missing. We'd just be in a world where clinical transactions were taking place versus relationships occurring, and that would break my heart if there were no nurses.
So a world without nurses would be a lack of information.
A world without nurses would be a world short on kindness.
Well, a world without nurses definitely would have no rainbows and no sunshine.
What would a world look like without nurses? It would be bleak.
A world without nurses, and I've seen nurses all around the world, would look a lot like a system of doctor medical care without the safety, the comfort, the personal hygiene, and the protection that nurses offer, and that is our core being. That's what our independent practice is. And no matter what setting it is, across the continuum, from outpatient to forensic jail time nurses to hospital nurses, which most people typically think of, it doesn't matter the setting. What matters is that the nurse provides all of that no matter where they are.
I would say that we would all have shorter lifespans. We would have more complications, more infections. And why is that? Because nurses care for the whole person. Nurses don't care for diseases or conditions, they care for people. They educate people, and prevention is our first priority.
A world without nurses. What a horrific concept to imagine. Imagine going into the hospital and you have the doctor and a bunch of techs. Most people don't know the extensive training that a nurse goes through, the holistic training. So if I have a patient that's perhaps diabetic and a Latina, I'm not going to give her the same menu. I know better than that. I also can monitor her labs to make sure she stays within the data points that she needs to be in, not for everybody. So we're bringing in automated information. We coordinate the care with others to the degree that we're always looking at the patient first, patient safety first. We're in a lot of realms. Just imagine that. We're in the prisons. We're doing parish nurses in the community. We're in the schools. We're everywhere. And we are working with the most vulnerable population at their worst. A world without nurses? No, no.
Not having someone to greet you the moment you come into the world, and not having someone to hold your hand the moment you leave this world.
I hope I never see a world without nurses. Nurses are the ultimate leader of the healthcare team. I've been a nurse for 45 years, so I've seen nurses in practice in almost every venue and opportunity that's available for a nursing career. But I have to tell you that the best part of it has been on the other side of that bed, being the patient in the bed. And I will never forget, as much as I loved my physician and the organization that I was working in at the time, when I had a stillborn, it was the nurse that told me. It was the nurse that handed me the pink blanket. It was the nurse that was there for me. And I will never, ever forget that. Nobody can take the place of a nurse in the healthcare team.
It also would mean you wouldn't have someone to help give you your vaccinations or help survey public health epidemics. You wouldn't have nurses at your bedside advocating for you, taking care of you, and educating you on how to take care of yourself and your loved ones. And
nurses have powerful decision-making authority, and our ability to work with patients and those we serve on health promotion and protection and prevention and restoration from illness to wellness, our wellness focus and our holistic practice really allows us to have a broad impact on the health of those we serve.
A world without nurses, all you have to do is look at areas in healthcare today that don't have nurses to see what the impact possibly is. So health insurance companies don't have a lot of nurses in leadership positions. There's some, and certainly those nurses have big voices, but there probably needs to be more. So you look at health insurance companies, they're not loved by providers, and they're not loved by members, because they tend to be a big barrier into getting the care that people actually need. So what would happen to health insurance companies if there were more nurses in place? That's the answer.
You would have families and friends and patients who wouldn't have that translation of knowledge. They wouldn't have the understanding from medicine to patient. We'd have the go-between where the nurses are really there, holding the hands, but also really translating the evidence, whether it be from research or in practice or in clinical arenas. We're really the ones to bring that evidence into the world in all different ways. And so the nurses are the ones that deliver the care in the right way, evidence-based practice, research, compassion, all the different ways, but they're the ones that bring the evidence to the patient.
A world where people suffer alone and die alone. There'd be no one there to hold your hand when you're afraid. Without nurses, we'd have schools where children don't get any health care at all, where no one is advocating for them, escalating their concerns, and speaking for them when they are the voiceless. A world without nursing would be a world not worth living in.
When I think of a world without nurses, I think of a world where there is nobody watching over you, the public, me, to teach me health prevention, health promotion, more complications of diabetes, heart disease. And you may not realize this, but nurses are experts in holistic care, meaning we look at you from the physical aspect, the emotional aspect, the social aspect, and then we are able to create a course of treatment that is not going to just help you with the problem you have right now, which could be a physical ailment, but also how are you going to continue your life? Do you have money for food? Do you have someone in the house to help you? Are you filling up your medications the right way? Because are you throwing your medications out that you don't use anymore?
What would a world look like without nurses? Well, imagine a time when you're sitting in your hospital bed and somebody comes in and just sticks a piece of medicine in front of you and tells you to take it and walks out and doesn't explain anything about that. Imagine your loved one is sitting in a nursing home and being cared for, but by a person who just comes in and takes their vital signs and walks out and doesn't turn them, and they end up with bed sores. Imagine a world where you don't have nurses that are in your community teaching you about the latest virus that has come about and you don't understand and have no one to go to. Imagine a world where nurses can only take care of you.
There would be a loss of people who care for our loved ones, who care for our environment, who care for our policies, both in facilities, at the government level, in the states, in the counties, in the cities. We would lose the people that care for our children in schools. We would lose for the people that address the environment and the impacts that our healthcare system has on the environment. We would lose constitutionally mandated care in our incarceration facilities. We would lose protection for preventable diseases and for chronic disease.
Well, nurses have always been the leader in health promotion. Started with promoting healthy lifestyles, immunizations, and they worked with public health, seeing patients and their families and paying attention not only to the patient, but to the patient's surrounding and the patient's families, to look for clean water and heat and the things that really are not thought of as healthcare, but indeed they are.
And what we would lack is really a patient advocate, a family advocate, a community advocate, and somebody that really could watch out for those who at times of illness are very, very vulnerable, and that even during times of wellness just need to be taught what needs to be taught. So without any of that, I think we would have utter chaos, and that could just really be cataclysmic.
When I think of that scenario, a world without nursing, I think of a world without hospitals, without long-term care facilities, without places, for one thing, where people go typically to receive nursing care. I think of people who are not able to be cared for even in their homes because there are no nurses going to those homes to care for them. I think of schools that have lay people taking care of kids with really complicated, extreme conditions. I think of public health I think of vulnerable populations that have nowhere to go, nobody to advocate for them, nobody to speak for them, nobody to care about them, care for them, care with them, partner with them. It is hard for me truly to imagine a world where citizens, families, vulnerable folks, everyday folks, don't have somebody to help be their voice in a very complicated world where healthcare systems are not systems and gaps exist. Care is not coordinated, it's not planned, it's not well implemented and executed, and nurses not being there to close those gaps, to coordinate that care, to implement and to evaluate. I can't. It's hard for me to imagine that world.
A world without nurses would mean that the protectors and the oversight for you are not there.
The nurses are the ones that deliver the care in the right way, evidence-based practice, research, compassion, all the different ways, but they're the ones that bring the evidence to the patient.
A world without nurses. What a horrific concept to imagine.
Who would care for your loved ones? Who would care for people and manage people with chronic illnesses? Who would care for you?
What would we lose if we lost our nurses in this world? We'd lose the heart of healthcare.